Welcome to Remarkable Conversations. I'm ACC President Christopher Kramer, and I'm excited to be joined by Dr. David Winchester, the Chair of our Board of Governors, and Dr. Eugene, the Chair of our Section Steering Committee. We're focusing on one of the college's greatest strengths, the work happening across our chapters and member sections. Chapters and sections are where connection, leadership, and collaboration come to life. They give members a community in which to share best practices, elevate local and specialty-specific priorities, and help drive the college's mission forward. In this discussion, we'll talk about how chapter and section grants are sparking new partnerships and supporting projects that build leaders, improve patient access, and strengthen care delivery. We'll highlight both U.S. and international collaborations, as well as some of the exciting work happening between sections and chapters. We'll also look at how these groups, individually and together, are advancing ACC's advocacy priorities and strategic goals, and we'll touch on some standout achievements from the past year. Finally, we'll look ahead, how members can get involved, how to make the most of these communities, and what to watch for at ACC 26 in New Orleans. Let's jump in. David, let's start with you. What are some of the new areas that the chapters are tackling?
So chapters representing all the different states across the country are doing a wide variety of activities to support the college's strategic pillars. And the chapter section grants are one of the mechanisms that we use where the chapters partner with our various sections that represent either specialty areas or career areas to come up with new programming that advances the strategy of the college. So that's the mechanism that we're excited to share about today.
So tell us about some specific grants to various state chapters.
A couple of them that come to mind that we funded last year, the Ohio chapter partnered with our Women in Cardiology section and created some brand new outreach to medical students, trying to encourage them to pursue careers in cardiology. So that program has been really successful. Another one that I think is really unique is the Hawaii chapter, who partnered with both the CB team and with our congenital section on developing a brand new collaborative care model to address congenital heart patients in Hawaii.
Terrific.
Yeah.
Those are exciting ways that chapters can get involved and start new programs. Eugene, let's turn to you. Tell us about some of the new offerings from the sections and councils.
Yeah, thanks, Chris. So I think first to educate some of the members about the sections themselves. So the first sections were actually created in 2004, the Adult Congenital Pediatric Cardiology and Women in Cardiology sections. And then the most recent addition was 2022, the Reproductive Health and Cardiobstetrics section. But more than 21,000 people are members of sections. And we have 14 academic sections, as well as 9 career sections that include Women in Cardiology, the Cardiovascular Team, Early Career. And then we also have some additional sections that are not officially sections for medical students and medical residents. But as David mentioned, I think we really enjoy our partnership with the Board of Governors to create these chapter section grants to meaningfully impact the health of our patients, as well as to provide educational activities. So I'll just highlight some of the things from what we have been doing more internationally. So since David works with the states, things that we have done with international chapters include one that was initiated a few years ago between Arizona, the Mexican chapter, and the Prevention Council. And their grant was entitled Establishing a Primary Cardiovascular Prevention Educational Resource for Undocumented Hispanic Populations in partnership with an organization called Ventanilla de Salud. And so that really was one of the first major initiatives with an international chapter. And then more recently, and I think, Chris, you were involved in this, was with the Cardiologic Society of India and the prevention section. And so we initiated a project with them called Increasing Air Pollution Awareness among school children and neighboring communities to mitigate cardiovascular disease. And so I know that they are finalizing the data analysis that we hopefully will submit for publication in the coming months. So those are some of the highlights of what we've been doing with international chapters with our councils.
Yeah, it was exciting to hear when I was in India about that particular project, because there were kids coming home from school and telling their parents and grandparents how to change their practice to improve the air around them, and how important that is to the future of air quality and health in the Indian continent. So really exciting work. So tell us, David, some other new exciting ideas that you've instituted. I understand you have a collaboration now with Jack Case Reports about instituting some new projects there.
Yeah. So the chapters are a great way for members of the ACC to participate in ACC activities at a local level, and getting to do it basically in their own backyard. Hallmark of that is going to be the chapter meetings. A lot of these chapter meetings feature case report submissions from trainees, and we've got 9 chapters now who have agreed as part of that case competition they're having at their meetings to subsidize the submission fees to get that case published in Jack Case Reports. And so we had the first chapter that submitted that was just this week. Wisconsin submitted theirs. And so we're looking forward to having several other chapters get those cases published in the Jack family of journals.
And is that every state or many states? How is that working?
So we, at this point, we asked for states to volunteer, and we just wanted to pilot it and see how it went. And of the several dozen chapters we have, several said that they wanted to do it right off the bat. But we're hoping to continue to expand it and look for mechanisms where even our smaller chapters with more limited budgets can also participate.
And Eugene, what are some of the major section achievements in the past year?
Yeah, well, thanks, Chris. So, I think one of the key things about the sections that I'm sure most members are aware of. So, first of all, there are 21,000 members of the college who are in sections currently. And the sections really have been a driving force for educational output for the college, as you know. And so when we look at some of the things that we have done in the past year, so up until about October of this last year, 54 clinical topic collection articles were published by members of sections for ACC.org. We also organized 12 webinars as well as 20 podcasts. And then when we look at publications from leaders and members of the sections, in the past year, there were state-of-the-art reviews that were published in various Jack journals. There's also been several concise clinical guidance documents that have been published as a result of leaders from the sections. And then in addition to our own Jack journals, if we look at some of the other output that has come from the sections, a very nice statement was published in Circulation last year. Another one from Sports Cardiology was published in The Lancet and the European Journal of Preventive Cardiology. And then finally, when we look at what the sections are doing, we are also very involved in driving industry partnerships. And so some of the sections, including critical care cardiology and the prevention councils, have been actively working with industry partners to try to enhance education for the ACC as well as for our members.
Well, let's pivot to advocacy and talk about how the chapters and the sections are working with the advocacy team at the college, and how members can get involved, and how they're working with the Board of Governors.
Yeah, thanks for the question. So I think when people hear the term advocacy, they may think that you need to come up to Washington and go to Capitol Hill in order to be an effective advocate. And that's an important part of what the college does. But we shouldn't lose sight of the fact that we have 50 states in this country who each have their own state legislatures and governors, and an awful lot of health policy occurs on the state level. Many of our chapters have some mechanism for engaging with state-level advocacy, whether it's a formal lobbying day or whether or not it's interacting with individual lawmakers on a state level. And so anybody who's interested in being an advocate, I would encourage you to get in touch with your governor and get things going on a state level, in addition to, if you've got the time, we'd love for everybody to come up to legislative conference in beginning of October. But let me ask Dr. Yang to talk a little bit about how, the chapters and sections have partnered, because, we bring a lot of enthusiastic members from all across the country, and our sections bring a lot of specific expertise on some of the issues that we want to advocate about.
Yes, no, I think really the intersection between the chapters and the sections with respect to advocacy has been highly successful. So one of the initiatives is really been focused on peripheral arterial disease and getting legislation passed, for example, in the state of Illinois. And that was driven by leadership within the chapter within the Illinois group, as well as with our national PAD council. I think, we really understand the importance of advocacy, since obviously reimbursement for procedures, for example, in electrophysiology or interventional cardiology or structural heart procedures, we need members from our sections to help, make sure that payments are not being significantly reduced for these services. And so as a result, we just recently relaunched our ACC cross-sectional advocacy work group, and the first meeting is going to launch next week. And so when we think about, where the sections and the state chapters can really work effectively together are around issues that maybe affect individual states, where the sections nationally can provide some guidance to members of state sections and chapters, around state chapters, to help inform them about how to educate legislatures on some of these key topics.
A nice example of advocacy work of a section recently was when the new nutrition guidelines were released by our HHS, and there were, as you're aware, some of the much of the material was right, but there are some recommendations that didn't necessarily jibe with nutritional guidance and heart health, and so the nutrition subgroup of the prevention section or council put together a response to the nutritional guidelines that's now on acc.org and will be coming out in Cardiology Magazine and on social media. And so that's an example of advocacy work of the sections, and so important to represent the college in the right light. David, how can members get involved in chapters?
There's so many opportunities that I would really encourage anybody thinking about or considering being more involved with the college to be part of your local chapter, whether that is like the advocacy things we've been talking about, whether it is one of the career stage groups, right? Because a lot of chapters have, at a state level, have recreated state level sections for women in cardiology or for early career or fellows in training. So there's a lot of opportunity there as well. And it's a great place to get to understand the scope and breadth of what the college can do. And then, like I said, you don't typically have to travel halfway across the country to do it. You can do it in your own backyard.
Yeah, traveling around to many of the state chapter meetings, it's great to meet the members and how highly motivated they are to attend their local meetings, get education, network with their fellow members, and learn about what's also going on nationally at the college.
Yeah, absolutely. And it's also a great place to develop your professional network of where you are. If you're in training now and you're looking for where that first job is going to be, and maybe you're going to stay in your state, that's a great place to understand what the workforce and employment opportunities are like. And if you're in your career already and looking for the next thing to do, being part of the chapter leadership is a great opportunity.
Yeah, it's been a stepping stone. Chapter governors have gone on to big things in the college over the last several decades. So definitely important stepping stone to leadership positions in the college. How about sections, Eugene? How can members get more involved in sections?
Yeah, no, thanks, Chris. My first engagement with the ACC really in leadership was through the Board of Governors myself. So I think it really is the best place to get involved with the ACC. But when people have, I would say, interests in perhaps getting involved nationally or internationally in your specialty area or career, I think that's where the sections can really help promote and develop leadership as well as opportunities. And so, I think, for example, because of the variability in the state chapters, some chapters will not have the resources to have, let's say, a prevention section within the state, or an electrophysiology section within their state chapter organizational structures. And so that's where we can really help. So if those individuals are interested, for example, in contributing to educational output around electrophysiology or sports cardiology, that's when individuals can then decide to join a career or one of the academic sections. And within each of those sections, we have working groups. So for example, in prevention, if you're interested in hypertension, then there's a hypertension working group that you can join to contribute to educational outputs, for example. And so that's really where I think there's a good merging between the sections and the state chapters, is really, when there are some gaps and where opportunities might exist through the sections that may not necessarily exist at the state chapter level.
And if I can circle back to where we started the conversation about chapter section grants, this is an opportunity for the average member. If you're really enthusiastic, passionate about a particular project that you would like to try and get done at a state level on a particular topic that aligns with the section, this is an opportunity for a regular member. You don't necessarily have to be the governor to initiate a chapter section grant. But get in touch with your governor, get in touch with your section leadership if that's the route you're taking through it, and do something that's going to help advance the mission of the college.
Yeah, I'll add on to that. So, I just was reviewing the latest batch of chapter section grants, and many of the initiatives and proposals are actually from members who are not the governors or leaders of the councils or sections themselves, and so a lot of it is based on people who are boots on the ground, who see some of the problems. For example, blood pressure screening, poor blood pressure control rates, and so those initiatives, many of them, are generated by members of the college who really are not engaged necessarily in the section council leadership, for example, but are recognizing some of the key gaps where I think the ACC, through the sections and through the chapters, can really, hopefully make an impact in improving the cardiovascular health within their communities and their states.
Great. Let's talk a bit about what we can expect to see in New Orleans in terms of activities related to chapters and sections. So what's going to be happening there?
So for the chapters, I think the most important thing to do, because ACC is obviously a huge meeting, and it's not hard to get lost in all the multitude of fantastic opportunities you have there. But a lot of chapters are hosting social events, and so I would, if you're going to ACC, figure out who your governor is. Look them up in the meeting app, figure out how you can get in touch with them, and make your way to the social event to connect with other people from your chapter.
Great. And there'll be a Board of Governors meeting?
There will be.
Yes.
Yes.
What topics will you be covering?
So all of the governors from across the country are going to meet on Friday, and we are going to be talking about things like how chapters and individuals, if you want to professionally leverage social media. So that's one of the things we're going to be learning from each other. We're going to be talking about some leadership challenges for governors and how you might deal with them. And then touching one more time on advocacy, we're going to be talking about the new Medicare ambulatory specialty care model for heart failure, which, if you have not heard about that yet, has the potential to really impact all of our members. And so the ACC is going to be doing an awful lot of discussion about that across all of our communication channels in the next several months, because that model is going to take effect January 1 of next year.
Yeah, I can't emphasize that enough. To go to acc.org, attend webinars, at the annual meeting, along through all of the activities of 2026 to learn about the ASM and heart failure, because it will affect your reimbursement, and it's important to get it right and work on your quality measures for heart failure patients.
Yeah, it's going to be.
This is not for heart failure docs.
It's not actually.
It's for general cardiologists.
It's for general cardiologists.
So watch this space. How about for sections and councils in New Orleans? I'm sure a lot of activities planned, Eugene.
Yeah, absolutely. And you can imagine that really the sections are driving a lot of the educational output for ACC 26. So I think about 60% of the program committee members for the organizing committee are members of sections, and more than 50% of the topic coordinators and co-coordinators. So, a lot of us will be very busy. And so if we look at some of the things that are happening from the sections, there are going to be 5 pre-conferences. 4 of them are basically being organized by sections, including sports cardiology, cardio-oncology, CV team. And so a lot of the activities and pre-conferences are organized by the sections. And about more than 40 educational sessions in the Lounge and Learn Education Zone are going to have been organized by the sections themselves. And additionally, one highlight session is going to be promoted on how to build a prevention clinic. And then finally, similar to the Board of Governors, there'll be 23-member section networking and special events during ACC 26. So many of the members of sections will be very engaged and involved in the programming for this upcoming meeting here in March.
Sounds like a lot to look forward to, and we hope to see many of you at ACC 26 in New Orleans. Well, thank you for listening to this edition of Remarkable Conversations. Today's discussion highlights just how powerful our chapters and sections are in shaping the future of the college and the future of cardiovascular care. Our chapters and sections are more than organizational structures. They are communities of leaders, problem solvers, and advocates who are driving meaningful change every day. Whether it's providing pathways for new and emerging leaders, improving patient access, strengthening care delivery, or amplifying our voice in state houses on Capitol Hill, their work reflects the very best of who we are as a college. As we look ahead, I hope today's conversation inspires each of you to stay engaged, stay connected, and continue finding ways to contribute your expertise and your voice. Thank you again for being part of this conversation and for everything you do. And in keeping with tradition, I offer this short toast. Here's to collaboration, to teamwork, and to the remarkable things that happen when we bring our ideas, our passion, and our purpose together. May we continue to learn from one another, lift each other up, and drive change that truly matters. Cheers to the work ahead and to doing it together.
Cheers.
Cheers, Eugene.
Thank you.
Thanks, Dr. David Winchester and Eugene Yang, for joining us today in Remarkable Conversations.
Thanks for the opportunity. It's been a pleasure.
Thank you.